Hello, and welcome back to the New Wave podcast, brought to you by the Urban League of Hampton Roads Young Professionals. I am your host, Dana Duckworth, aka The Big Speaker, and this is episode 2 of the New Wave. Today's episode is the Civic Playbook. I am so excited to welcome my special co-host for this episode, Alana Evans, who is the Civic Engagement Chair for the Urban League of Hampton Roads Young Professionals. Tell the audience hello, Alana.
Hey guys.
And together we are so excited to welcome a very, very special guest. Alana and I are welcoming Senator Mamie Locke to the show. Welcome, Senator.
Thank you so very much. I'm so glad to be here with you.
As are we. We are so excited to have you.
Yes, ma'am.
I'd like to talk a little bit about your background and what inspired you to pursue a career in public service. What really drives your commitment to advocacy?
Well, I am by profession a college professor of political science. So I teach politics, I teach government. And I have been doing that for longer than both of you were probably born. and having been engaged in politics, actually since my high school years, I was always actively involved, actively engaged through high school to college to graduate school. And when I started teaching, I always said to my students, you're here for 4 years. This is your community. You need to know what is happening in this community because decisions are being made about your life and whether or not you're going to live here after you graduate or even if you leave. For the 4 years that you're here, people are making decisions that impact you at City Hall, at school board meetings, at planning commission meetings, at all kinds. They are making decisions that are going to impact you, whether it's, and you're here at the university, you're separated by a river and a bridge, from downtown, and even if there's a decision about whether or not to close a restaurant downtown, or close a grocery store downtown, they're making a decision about what's impacting you. So go to a city council meeting, go to a planning commission meeting, go to a school board meeting and listen to affect you. And so we were at a school, it was a city council. And there was a decision made that the students were like, well, we don't understand what just happened. And I said, well, part of why you don't understand it is because that decision was made earlier in the day.
Right.
And it was made, in a room where you didn't hear the discussion. You didn't hear how that decision came to be. And you have to be in the room where it happens. And because you weren't there to know how they came up with that final decision, what you heard was the outcome.
Right.
You didn't hear what went on before. And so in order to know how that outcome happened, you have to go and decide and be in on the decision-making process ahead of time. So that is a conversation I was having with some friends about how the students were upset. And they said, well, why don't you run? You're sitting here talking about it, and how that decision occurred. And I said, no, I'd rather talk about politicians than be one. And ultimately, the conversation led to me running for Hampton City Council.
Okay.
And actually, I lost my first race, but interestingly, with nobody knowing who I was, no name recognition at all, and Hampton's races are citywide, and it's the top 3 vote getters who win. I came in 4th, losing only by about 100 votes.
Okay.
And they have races every 2 years. So I ran on the next cycle and I won.
So speaking of students and how, a lot of students, we do tend to have a high houseless population. When we speak specifically like with students, what are the biggest policy challenges you see in the housing crisis and what steps are being taken to address them?
One thing that generally happens is, and I saw this up close and personal when my niece went off to VCU, it was easy to get housing because it was always available the first 2 years.
Yeah.
And then in that third, it was like, okay, fine. We took care of you the first 2 years. Now, sorry, there's no on-campus housing available for you. Go out there and figure it out on your own. And so, and then it was a case of, okay, you go out there and figure it out on your own, but what does that mean? And it means that you have to go out there and try to find an apartment that you can afford.
Mm-hmm.
Somehow people think that because you're in college, you got money, and that is not a reality for many college students. You have to, find something you can afford, find a roommate, one that you can get along with. You have to split these costs with, and something reasonable. If you don't have a car, how are you going to get back and forth to school?
Exactly. And that's a big accessibility issue.
Right. You have to take all of these things into consideration. And so many students, fortunately for Hampton built an apartment complex right across the street several years ago. So that was available. And then there are a number of apartment complexes in and around the university within walking distance. So that made it a little less complicated for a number of students. And so, but that is not always the case for other young people who have difficulty in trying to solve that housing problem. And now that we're in the middle of an affordable housing crisis, it's becoming even more complicated for not just young people, but for most people to try to find some place to live.
Yeah, so we see many challenges when it comes to affordable housing. And thank you so much for speaking about that in regards to students. I do want to say that I am a proud HBCU alum of Norfolk State. So it is lovely to be talking to someone who shares the excitement of the HBCU culture and supporting our Black and Brown students the way that you do, and keeping things on the forefront for them. That I like what you said earlier when you were like, hey, you are living in the outcome of the situation. You were not in the room when the conversations and the decision was happening. So for me, as a person who's often living in that outcome, it makes me want to be more involved in what those decisions are before I'm just outraged by that outcome. And I feel like as a country right now, we are living in the outcome and kind of missed some steps into how we got to this outcome. How can everyday citizens like myself, granted, I'm not huge into advocacy like Alana is, but how can people like myself effectively advocate for change and ensure that our voices are heard in the government?
So I believe that people generally don't get involved until it just kind of smacks them in the face and knocks them around a bit. And one of the things that I would always say in the classroom is politics is in your face from the time you were born, until the time they cover you up with dirt, and students kind of look at me like, well, what are you talking about? I said, you get a birth certificate that comes from the government. I said, you get a death certificate that comes from the government. I said, so politics is going to be in your life from the time you're born, until the time that you die. So at the very least, you need to put, affect what happens to you. And you've heard this thing, those dashes, your birth date and your death date. What happens in that dash? What are you going to do, in that dash of your life, that is going to impact your life and what you're doing to ensure that there is something that you are having an impact on, and an outcome that is not just beneficial to you, but beneficial to, your family, that's beneficial to your community, your neighborhood, and ultimately that's beneficial to the state in which you live. Because at the end of the day, there is going to be either a negative outcome, or a positive outcome. I would hope that we would all want the positive outcome that's going to have an impact on us. So my thing has always been, even if you're not that vocal advocate, there's always something that you can do.
Mm-hmm.
Whether it's picking up a phone, to call somebody's office and say, I don't like, X, Y, and Z. Can you at the very least think about, considering this particular issue in this particular way? Or I'm concerned about that pothole that's in my neighborhood. That's or my neighborhood doesn't have sidewalks, and there are kids riding their bikes, up and down the street, every day. Or why isn't there snow removal on my side of town in the same manner that there's snow removal on the other side of town?
Yeah.
And one of the things that the pandemic did was to show the disparities in healthcare. More than anything else, it demonstrated the disparities in healthcare, and that it exacerbated a number of those disparities by who was dying as a consequence of COVID-19. And so one of the things that we were saying during the time is those disparities didn't happen in March of 2020.
Right.
Those disparities had happened years before, and the pandemic merely exacerbated them.
They had always existed.
They had always existed. And I just said recently to someone who was talking about, we're having so many problems with education. Education is bad. And I'm like, come on, people. The achievement gap existed long before the pandemic. So don't come, yelling and screaming about how awful education is it wasn't a consequence of the pandemic that we're having these problems with education. You all were underfunding Black and brown communities long before the pandemic.
Correct.
So achievement gap was merely exacerbated by the pandemic. So you were underfunding HBCUs long before the pandemic and years before. So don't come here with this, HBCU funding when we're saying, you're going to start level funding. The same money that you're giving to the land grant, Virginia Tech, you're going to give the land grant, Virginia State. So, and our voices are ones that, you can write a letter to somebody, and even if they don't, put your letter in the trash, at least you got the letter out there.
Yeah.
Many different ways that one can advocate and be a voice. You can be, as Barack Obama said, I started out as a community organizer. Anybody could be a community organizer and have their voices heard out in and about their communities. And, mobilizing people to participate in their communities, in their neighborhoods. You don't have to always be the biggest voice out there, but you can be a voice.
Right.
Yeah. You gave us some very tangible ways, some easy ways. So a lot of times we think about politics as this big, huge monster. And it's like, I don't even know where to start or where to go or how to be active. So you gave us some real ways, some easy ways for us to ignite ourselves and start participating in advocacy.
Yes, ma'am. So I had the pleasure of meeting you, I believe it was week before last, at Navigating the Storm panel out in Hampton with Hampton's NAACP. And so I know that you had mentioned Medicaid and SNAP that are funded by state and federal funding. And I know that that is a particular legislation that you have an interest in. And so could you kind of speak to that? Like, what legislation are you currently working on that directly impacts the working class? And how can the public support it? So, we see a lot of things being cut right now at the moment due to these executive orders. And so I just really appreciate that you highlighted that at that moment in time with the public.
with Medicaid, first and foremost, one of the things we need to understand is it is both state and federally funded. And the state, in the most recent budget that we passed, the state came up with its share of funding for Medicaid. Now we have to be concerned with, is the federal government going to cut its share of what comes out to the states? And the answer to that is yes. Even though the Speaker in the House of Representatives sat on television and lied and said, no, we're not touching Medicaid, we're not touching SNAP, we're not touching Medicare or Social Security, we're not touching any of that. So as soon as he said that, average people don't basically understand.
No, they don't.
Budget or how that occurs. Immediately I said to myself, okay, you're taking $800 billion out of commerce and energy.
Wow.
Where Medicaid funding comes from. Then where's the $800 billion coming from that you're cutting?
Right.
Medicaid is your largest funded program in there. So, forgive me, sir, if I think that's where you're making the cut.
Right.
I think you're taking it out of Medicaid. And a lot of people don't know the SNAP actually comes out of the agriculture program.
They're not.
And they don't make the connection that, SNAP is coming from agriculture. So you're not going to connect that money is being cut out of agriculture. Wow. So no, that's not where, my EBT money is coming from. Yeah, that's where the money is being cut.
Right.
And that's where a significant portion, that's why you're being cut out there. So here in the Commonwealth, we have to make a decision. If they're cutting $800 billion out of Medicaid, they're cutting SNAP out of agriculture, how do we make up for that significant cut?
Right.
And what's Virginia's loss? Okay, we've already paid our state share. Then how would we make up the federal share of that cut?
Right.
And the question then becomes, do we make cuts elsewhere? Do we take it from transportation funding? Do we take state park funding? Where do we make up that big of a difference? Because, I'm not going to let people go hungry.
Yeah.
Right.
I'm not going to go without health care.
Yeah.
And Virginia was one of those states that actually expanded Medicaid to cover individuals who couldn't afford health care, but they didn't qualify for Medicaid. So we have like 700,000 people who would go completely without health care if the federal government simply said, oh, sorry, that's gone. So we would have to figure out how we're going to cover those 700,000 plus those who automatically qualify for Medicaid. So those are discussions that we are going to start having once we figure out where is this $800,000 and what share of Virginia is that impacting and how do we make it up?
Absolutely.
No, we'll make it up because we're not going to let people go without and go with health care.
Yes, ma'am. So yeah, it was a really good panel. I really enjoyed the knowledge and the gems that you dropped during that panel. And so one of the things that I was kind of considering at that time was, how do we kind of reach across the aisle to, people who might not necessarily agree with this side of politics, right? So how do you balance the political pressures with doing what's best for your constituents? And how can we as constituents directly assist in pushing forward your agenda? So how do we, how do leaders from different political perspectives collaborate on key issues? What does that look like for you?
One of the things that we try to talk about is that it isn't just Black and brown people who are on Medicaid.
Right. Yeah.
or who are on SNAP.
Mm-hmm.
If this $800 billion, and depending on what the impact is to Virginia, um, it is going to impact most significantly rural areas. And rural hospitals may close because during the pandemic, it was a rural hospital that closed in Southwest Virginia.
Mm.
First and foremost, you need to understand that it is going to impact you first.
Yeah.
And all of this going on with the Department of Education,
Right.
Rural areas is going to impact you first. And so we need to understand that it isn't, you may think that it is Black and brown people who are going to be the subject of all of the cuts and closures that's being discussed and done, across the Potomac. But, it's not. It's all of us who are going to become a part of this problem that's being done at that level.
Right.
And that if we don't want our constituents, and our constituents aren't just Black and brown people, and if we don't want the constituencies to be negatively impacted by what's going on there,
Right.
so it's in our best interest to collaborate on how we best work against them. And one of the things that we've done is, I noticed the speaker put together what he called an emergency committee to look at what's going on at the federal level. We've done the same thing in the Senate but we've used a part of our finance committee that deals with resources to actually look at, okay, what is happening at the federal level, and looking at our resources and how do we best combat, what's going on. It's bipartisan, it has people from all across the state, from different regions of the state. And how do we start to look at how do we begin to address these issues and its implications for the Commonwealth? It's going to impact rural areas. It's going to impact suburban areas. It's going to impact, our urban areas. So how do we best begin to guard against this? And it's going to take us working together collaboratively, in a bipartisan way. It's not just Black and brown people who are going to feel the brunt of this.
Can you share a time when public advocacy influenced policy decisions and something that came from a specific group or a specific person?
We've had any number of issues where the public has been very, very actively engaged on specific issues. One was the ERA, where folks came up in very large numbers to push for passage of the Equal Rights Amendment. They came year after year after year, to the point where it was like, okay, we think that we've reached a critical mass of legislators who we've convinced that passage of the Equal Rights Amendment is vitally necessary and very important. And it got to the point where it was a bipartisan effort to actually get the Equal Rights Amendment passed.
Oh, wow.
And Virginia became the 38th state to do so. And you need 38 states for it to actually get put into the Constitution. Medicaid expansion was another, where it actually took, we have been trying since the Affordable Care Act was passed in 2010. It took us 6 years to actually get to the point where the legislature would even consider Medicaid expansion passing, even though it was going to impact 700,000 people being able to get health care and stop using emergency rooms as their primary care physician.
Wow, that's amazing.
But what it took was an election. It took an election and Republicans losing 15 seats in the House of Delegates. And people saying, we want this.
Yeah.
This is important. We care about this. And It's going to give medical coverage to people who, I mean, and this is working families, because their argument was these are people who are lazy, don't want a job. They just want
Right.
a handout. And Medicaid expansion was for people who had jobs, sometimes two jobs.
Exactly.
People were not making enough money in health insurance. So
Exactly.
this was for working families and to give them health coverage. And so we took that election, to say, okay, you don't want to give it to us, then we'll change the seats.
Yeah.
And elect people who care about Medicaid expansion in the Commonwealth of Virginia, and to give us this necessary and important healthcare information and coverage in the Commonwealth. And the very next year, what happens? We get Medicaid expansion.
And I've seen situations where people were required, in order for them to get either Medicaid or SNAP, they were required to work a certain amount of hours. Like they couldn't not have a job, even if they were disabled, which that was also, a barrier. So when people say that, oh, well, these are people who aren't working or that they're unemployed, that's not always the case. And that's not always true either.
So what barriers exist that prevent meaningful change in economic equity or gentrification, and how can we work to overcome them?
Oh, no, it's a lot. One of the things that we need to talk about is that the tax structure in the Commonwealth of Virginia really we need to take a very hard, strong look at how it is established, and we need to establish some tax equity in the Commonwealth. We do have what's called a tax study commission, but we've been kind of going back and forth with what would be the best kind of tax structure to have, because someone who is making $1 million a year, a firefighter, they're in the same tax bracket.
Wow.
It's absolutely no sense. Why should this firefighter or this teacher, pay the same taxes as somebody who's making over $1 million?
Right.
Yeah.
So we need to have some tax equity in the Commonwealth. So we need to have people who are at that level of $1 million or more pay their fair share. So that's one of the first things. And we also need to start looking at how can we do better with building and more affordable housing and having individuals pay fair rents, more sustainable housing, for individuals and families. And one of the things that we've done in this budget, which I hope stays in the budget, is to put in a pilot program for families to give them a rent stabilization plan. It's just a pilot program for Northern Virginia roads, and it keeps families intact in school districts, because kids have been moving, because the families have to move. So also just a child moving from school to school, sometimes 2 and 3 times a year. So this is to help give families rent support so that they can stay intact, one, in stable housing and in a stable school district. And what we're hoping will show is that when that happens, the child's education stabilizes, the family unit stabilizes, and you're not spending money, unnecessarily, on the back end, on the criminal justice system, or on other things that you don't need to be spending money on, because you're using it the right way.
Exactly.
So those are some things I think that we can do as a system. And this is not, as some folks would say, giving money away to people who don't want to. This is providing necessary foundation to help families grow and emerge into giving. This is like helping hands to lend support to families to stabilize themselves?
So I really appreciated one thing that you had mentioned before, because I do feel like with all the executive orders that are going out, to a certain degree, it's a bit of a scare tactic. You did mention at navigating the storm, DEI is codified in the state of Virginia. And I would really like to highlight that on this platform so that people have, some sort of faith that they're not losing their livelihood because their jobs are going to go away, right? And so because we see that DEI has always been labeled as something that is not basically 90% of the population within the United States, what role does bipartisanship in this current political climate play in advancing advocacy-driven policies? And how do you navigate that? So as a Black woman who is in the advocacy space, how do we navigate that, moving forward in our careers instead of just being basically labeled as DEI hire or being seen at, to say that all of your accolades and your accomplishments were simply just, given to you and that wasn't something that you necessarily worked for.
Okay, so one of the things that I believe that let's all three of us take a pledge. We're going to change the narrative.
Okay.
First and foremost,
period.
Black people are not the primary beneficiaries of diversity, equity, and inclusion.
We are not.
Correct.
And if you go down the list of diversity, equity, and inclusion, we are way down that list.
We're like 8. We're like number 8.
Categories are. So when people say something to me about, DEI hires and so forth and so on, I said, I was not standing on a corner. And somebody threw a doctoral degree at me and I caught it.
Okay.
I worked for it, earned it, and I'm probably far more experienced,
Absolutely.
at what I do than
Yes,
you
ma'am.
ever will be. And I don't owe any explanation to anyone about where I am and how I got here.
Correct.
We have to start to change this narrative.
Mm-hmm.
You're not going to throw and label DEI at me. It's the reason why you're incompetent.
Right.
And why you cannot accomplish anything here. You've been here for over 250 years. And we were enslaved for how many of those years?
Correct.
And you are therefore saying that I can't do X, Y, and Z when you held us down, and we've had to scrape and scramble to get to where we are, and you had nothing holding you down. Don't go there with me.
Right.
So it is up to us to make sure that we change this narrative.
Right.
About what DEI is, what it was designed to do, and that whereas you've had absolutely every opportunity and no obstacle in your way, and you have put every obstacle in our way, to achieve certain objectives, just because you can't get there, don't make this narrative about me.
Right. So for those that don't know, DEI is codified in the state of Virginia.
It is.
So really just making sure that we have, those cultural competency trainings and, just giving a certain level of empathy and grace for each other and understanding for each other. And what I find so funny about the word DEI is it's not even just DEI, it's DEIA. We forget the accessibility part. If you wear glasses, you are DEI. Like things that are that simple. And so I kind of want to take a moment in this podcast to just highlight the fact that there are resources out there to help people. We have federal workers that are losing their jobs. Awesome person that came in, Miss Stacy Short, that is part of, the federal government union, where right now they have a coalition that was, I believe, I'm not sure if it was the Senate that came up with a coalition to help federal workers who are losing their jobs, and just making sure that we're taking care of our community, So with that being said, what advice do you have for young advocates looking to make a difference in their communities? I know we had stated, at the panel that there needs to be an intergenerational conversation, that, politicians are always saying we're young people, and how would you like for us to show up to support you?
I believe in what John Lewis always said: get into necessary trouble.
Mm-hmm.
Mm-hmm.
And wherever you see that there's a need for that necessary trouble, get out there and become engaged. And we need young voices and young people now more than ever.
Mm-hmm.
And I think that part of what we as the more senior generation, I'll say older, more senior generation, what we're not doing is meeting young people where they are and getting them to tell us where they want to fit in and what they want to do, instead of telling them where they fit in and what they ought to be doing. And so I feel that we need to also let young people understand how all of this is impacting their lives. That's why I used to send folks to the city council meeting. I said, go listen and hear what they're talking about. And so that you will hear what they're saying about you.
Mm-hmm.
And they will come back and say, do you know what they said about HU? I said, I wanted you to hear yourself.
Right.
And so I think that once young folks start seeing what is being implemented from 2025, in terms of Pell grants, loan repayments, the lack of availability of loans, and the fact that certain programs and are being cut. They may not think that what's going on at the National Institutes of Health or at the CDC or with the National Science Foundation may be impacting them, but it is.
It is.
Because I was working on a National Science Foundation grant with someone at Hampton University, and she showed me the letter that they got.
Yeah.
Oh, by the way, you can't keep talking about this, or your money's going to be cut. And their students are also part of that grant.
Yeah.
Yeah.
It hits you here. So you need to understand that all of this is going to drop down on you. What if your parent is a federal employee?
Yeah.
Right.
Or that if you were a part of ROTC, that there can no longer be recruitment at your campus.
Yeah, I did see that.
So there is stuff that's coming down the pike that's hitting you right in the face to say that you are not really considered to be a part and parcel of this country. Yeah. So as Al Sharpton always said, we need to rise up.
Right.
And you're rising up that you need to, one, understand, that you need to educate yourself. And you can't educate yourself just by reading headlines in the shade room.
Not okay,
They were surprised. They were surprised when I knew what the shade was. But it's like, you got to get beyond that.
Right.
Absolutely. This has been an amazing conversation, and we are winding down our time with you. We're so grateful that you were here. Before we let you go, what's the best way for constituents to stay informed and engage with the legislative process?
Okay, so, and I always want people to know that you need to hold these people you elect, including me, accountable. Don't just vote and then say, okay, I'm done. No, you elected me to do something. So, and if I'm not doing what you elected me to do, then hold me accountable for that. You hold every elected official accountable for what you elected them to do. And if you don't think that I'm doing that, then reach out to all your elected officials should have a website, or about which you can contact them. They have email addresses. They should be on social media. Contact them that way. You can contact them via the phone numbers that they have on their social media sites or on their websites. Reach out to them and let them know what you're thinking and how you want to, or even if you want to become engaged.
Yeah.
That's a way to get involved with that's how I've gotten many of my interns. I have 3 high school interns right now who just reached out and said, "Can I be in your office?"
Wow.
And I'm like, about all means.
Wow.
I have a woman, she's graduating from college this year. I got her as an intern in the 10th grade.
Wow.
That's amazing.
So there are ways for everyone out there. If you don't like what you're seeing, now's the time, to get engaged, get involved, and have your voice heard.
Right.
And the only way we're going to know that is if you reach out.
Thank you so much, Senator. I am so grateful for you taking the time to join us here on the New Wave podcast. It has truly been a pleasure to hear from you. And Alana, as my co-host, thank you so much for the work that you're doing in the Hampton Roads Urban League as a young professional, chairing that civic engagement community. Please let me know how I can support you. I said I was going to get active, so hold me to it, like Senator.
Yes, ma'am. It's awesome, just having the opportunity to really just put something out there, especially the information that people really aren't aware of. So
Absolutely. Well, this has been another episode of the New Wave podcast, and I have been your host, Dana Duckworth, aka the Big Speaker. If you would like to join myself and Alana and become a Hampton Roads of Urban League young professional, you can do so by going to ulhr.org/young professionals. You can catch the New Wave on all podcast platforms and YouTube. Make sure you download and subscribe. We'll see you on the next episode. Thank you so much for joining us. Bye.
Bye.
Bye.